Hello, everyone. Welcome. I'm Angela Love-Zarenka with Lactation Education Resources, and I have the great privilege and pleasure to introduce Nikki and Nikki. And today's topic is lactation unicorns mixing other credentials with the IBCLC. Nikisha?
All right. Hey, y'all. Oh, it has been a while since we were with you, and we're so
Mhm.
excited to be back. Although we feel a little rusty, like we got to get our sea legs again.
Got to get ourselves together.
I am, as Angela said, Nikisha Killings, within LER, who is our gracious host who makes these discussions available. I am Director of Equity, Inclusion, and Belonging. Aside from that great work, I am also a private practice lactation consultant and equity strategist, and all the things out in these lactation streets that we will talk about as we get more into the discussion of wearing several hats and mixing credentials. One I'm most proud of is being a good troublemaker with my co-host here in our organization called Nikki and Nikki Lactation Career Consultants. Take it away.
Oh, that was so special.
Yeah.
Thank you. Hello, everyone. I am Nikki Hunter Greenaway, also known as Nurse Nikki. I am a board certified family nurse practitioner, an IBCLC, a mama, a wife, and all of those things. I'm so happy to be here. I'm also one of the co-founders of Nikki and Nikki Lactation Career Consultants, where we're helping y'all get to that finish line and take that test. So thank you so much. And today, before we get started, we just need to check in.
We need to. Yeah, yeah. I'll
It's
start
been a
because
minute.
I feel like your check-in may be more significant than mine.
Oh,
So I'm gonna just jump in right quick. So I am I'm here. I'm here. I ran, literally ran into this room to be here with y'all today. And that's how life is going right now. It's pretty busy, pretty hectic. And even though private practice is not keeping me the busiest in this moment, I have at that time is being filled with lots and lots of other projects and work and really working to get equity in birthing and breastfeeding out there in front of folks. So we are all healthy and well. We just came back from a socially distanced and masked family reunion.
mm,
That was interesting, but really well done. I'm really proud of my husband's family for pulling off a really safe event where we could connect with so many older generations in our family. So really, I'm sitting in a place of gratitude today. I think that about sums it up. How about you, Nikki? How are you?
I'm good. I do want to pause because Nikisha says this thing. She's like, I'm, doing private practice work and I'm doing other stuff. She does have a private practice. It just looks differently from other people's private practices.
I'll take that. Thank you.
And I want her to shed light on that later as we talk about mixing our credentials.
Okay.
But I'm doing well. As my mug says, my brain has too many tabs open right now, and just a lot of things going on personally in life, and one day we'll share those. um, but but yeah, I'm in a different. I'm in my bedroom, which I haven't really been in here in a long time because my office has a mold in it, and I have to move out of my office. So if you hear my voice sound extra froggy, that's because I have laryngitis from mold. But other than that, I don't have any complaints. Well, my kids are at camp and life is good. So I'm happy to be here with y'all today to talk about our unicorn status.
Yay for kids at camp. I'm a little jealous about that because y'all will probably hear and or see mine before we are done talking today. Um, yeah, I'm glad you're well. Nikki ran past that mold, but I'm sure someone out there can relate to just things happening in your workspace that you could never have predicted and that really throw everything out of whack. So kudos to you for showing up today, even with your voice as froggy as it is. It speaks to your commitment to giving information, good information to our audience, and we appreciate that about you. Um, Yay! How are y'all doing out there? How are y'all doing? It's July. We haven't seen you since May. We would love to know. Angela, is anybody talking to us?
Hi, yep, they are. Let's see. We have people here who are from Atlanta. We've got Massachusetts. We have Ontario. We have
Shout out to Canada.
Oklahoma. We've got California doing well.
West Side, okay, welcome.
Memphis, Tennessee is here saying howdy. So yeah, we've got people from all over. Oh, we've even got Iowa. Iowa's in
Nice.
the house.
Oh, Iowa.
Nebraska, someone just finished their nurse midwifery education. We've
Ooh,
got Chapel Hill,
Oh,
Texas.
congratulations.
So all sorts of people from all over. Oh, and here we've got somebody from the UK.
there we
Great.
go. All right, you
Come
win.
on, y'all.
You win.
You're the furthest. You're the
South
furthest.
Dakota. Oh, here we
Time is
go. Saskatoon. Oh, wait a minute. Saskatoon is calling it. That's Canada. Up north in
Is it
Canada. So,
Saskatoon? Have I been saying that wrong my whole life?
well, maybe I'm saying it wrong, but
I don't know.
there we
All
go.
right.
well. That was
So,
today years ago when I heard it, so I don't know what you're talking about.
type
So
that out
thanks, everyone.
phonetically, attendee,
Thank
please. We
you.
would like to know how to say that correctly. Oh my gosh. Wow, welcome from all over. And I think the information that we'll share today may vary depending upon your region and or country. But we're going to jump into it. We are excited to talk about what it looks like in practice and in theory to be a lactation supporter and hold some other credential that may be, I don't know if competing is the word, but you're acting in both capacities. And what does that look like and what's appropriate and how do you even embark upon such work? We are lucky to have a fantastic unicorn on with us today. One of us or both of us, depending upon how you look at it, are operating in such capacities already. And we want to hear from you if you are. Welcome, Romania. Ooh, Romania, welcome. You win. Now you win.
Oh, you win.
We want to hear from you in the audience if you are working, wearing two different hats, clinical hats or professional hats. And if you're on your way into doing so, you're considering it and trying to figure out what that looks like and what your questions are, so we can speak directly to those. All right, where should we begin, Nikki?
I can start.
Okay.
So, in my community, in my space, in the state of Louisiana, I am known as a unicorn. I am the only Black nurse practitioner IBCLC in the state. And with that, I became an IBCLC. The mystery has been solved in 2018. It was a mystery. I didn't know. But I was only one of 5 in the space at the time. I was the 5th Black one in our space. And the reason why that's significant is because in the state of Louisiana, our rates are low, 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 low. We are number 50th in breastfeeding now. We switched back and forth with Mississippi, and Mississippi has now taken number 49. But we are number 50th as far as breastfeeding. So we can just say that that's the importance of that. But I would say it was a conflict for me as far as so many people pushed me to become an IBCLC, but then I was like, but I'm a nurse practitioner. Like, I don't understand, why do I need it? And you may be feeling that same way also, but once having it and putting those two together, then it kind of put me in a place of, I do feel sometimes that it is competing, and only in the sense of when I'm trying to convey my recommendations to or talk to a peer who is not a nurse practitioner and talk to them about the patient, I put a lot of medical jargon in there and medical recommendations in there that are not within the scope of the IBCLC. So I struggle with that sometimes in our peer spaces of IBCLCs, of trying not to be too medical. But I do think it has afforded me opportunities in the hospital and in the medical world of, I know how to handle this on a medical level that some of my nurse practitioner and physician peers are unaware of. They're like, I don't know about this. I don't know how to do this. And so I think it is a nice blend for sure. Obviously, it affords me the option to bill insurance, which in the state of Louisiana, IBCLC cannot bill insurance unless you are a provider. So it does give me these unique opportunities that I would not have had. So I like this space. It can be challenging with the diagnoses and stuff because I don't want to have anyone overstep their scope.
Yeah, thank you for sharing that. A couple of things came up as you were talking, and we have to shout out to Bahrain. Bahrain, I think, is the closest, farthest person now. Y'all are showing up. A couple things came up. So one that came up is how important and how impactful it can be to have someone with a lactation credential sitting at tables that we normally don't get to, right? And so that's part of why you're a unicorn, because you get to bring an expertise around lactation into rooms where oftentimes folks have none at all. And it can be the difference between providing optimal care to a family and suboptimal. So as Nikki said, she's in rooms with nurse practitioners and other advanced clinicians that oftentimes IBCLCs and other lactation supporters aren't invited into those spaces and aren't welcomed or respected in those spaces. And she can show up and say, hey, I can speak your language, fellow medical providers, but I also know what folks need to be set up to succeed in breastfeeding. Same for some other unicorns that are well known. Dr. Leslie Southard, who we wanted to be with us here today, she had a conflict. She is the lactation pharmacist. If you've seen her work, she is, amazing.
Right.
Her work is she's a pharmacist, PharmD, Dr. Southard. She's a pharmacist, but she also is on her way to IBCLC. She's gotten some credentials already in lactation. How many times have we talked to families about going to get medication and their pharmacists have said, oh no, just based on their limited knowledge of breastfeeding, no, you can't breastfeed with that. Oh no, you can't, and they assume what's not good for pregnancy is the same in lactation. We know there's some significant differences there. And folks tend to, take the CYA route, right? They say, well,
Right.
I'm going to err on the side of caution and say pump and dump or stop nursing for this. And when you have folks who are knowledgeable about breastfeeding in those spaces, it makes a world of difference. In radiology, reading scans, this person can tell the parent, oh, you don't need to stop nursing for this particular scan. When we talk about some of the more common ones are occupational therapists, speech therapists. Speech therapists are pretty common, I think, at this point, because they, have the opportunity to engage with all the oral anatomy. It makes sense to kind of follow that through, pull that thread, and get some lactation insight as well, especially if you're seeing quite a few infants. But then there are some really interesting different ones. Nurse midwives is another really common one. Doula is a very common one where you see the combination of credentials. But I've heard of even veterinarians who get the credential, or other breast care clinicians who it makes sense for. Dietitians, someone's mentioning as well. There's some great combinations, but again, the value there is that you're bringing this lactation expertise into spaces where it often doesn't exist, and you can make the difference between someone getting really great care and getting no care at all.
Right.
The other piece of it that came forward when you were talking, Nikki, is about volunteer spaces. So, and as we're talking about wearing those different hats and competing hats, I came into this work, as many of you know, as a peer-to-peer supporter. I came in as a La Leche League leader first. There's a distinct method for La Leche League leaders who are also IBCLCs to manage families. And so if we see a family that needs more clinical help, there's a procedure we have to follow before saying, oh, I'm an IBCLC too. Let me help. Let me fix that. Because the Leche League is a non-clinical, supporting families through basic common non-clinical issues. And so if the family needs more elevated support that's more clinical, we have to follow some protocols so that we make sure that there's not a conflict of interest, that we're not putting ourselves forward in a way that starts to muddy which role we're seeing families in. And I know some of you are seeing some of those same issues. In that organization, the way to do it is to provide to the family options of clinicians they can see. You can be on the list, but the list can't be a list of one with you on it. You provide them options of at least 3 clinicians, and you say to them, if there's no alternative, I can see you in that setting, but it has to be completely separate from this. So you need to see me through, this website. I bill you. I completely take off my volunteer hat to see you in that setting, and there has to be some really clear delineation there. And I know that that's the case in a lot of volunteer groups, but also in different melding of different types of work, volunteer work with lactation support. So I'll stop there. We've got some great feedback. I'm gonna look at the comments. Nikki, if you have anything to share while we catch up on what y'all
Yeah,
are saying.
so one of the things I think the goal with combining credentials or adding credentials is answering the question of how can I continue care? How can I bridge a gap or fill a void? For example, if you're a birth worker and you're in there, you're doing your prenatal, you're doing your birth, helping with labor, you're helping with postpartum, and then you get to this lactation piece. So a lot of times, sometimes, you have to call another, you're like, this is not my lane. Let me call somebody in. How can you bridge that gap? How can you continue that sequence of care that you're giving, or a pediatrician, or, one of my favorite combinations is a lactation therapist. Is a therapist that's also a lactation consultant, like Jabina
Shout out
told
to
me.
Jabina.
Like,
Yeah.
hey, that is like when I'm like, dang, that is a light bulb. Because when I go in to visit, a lot of my primary focus is postpartum care. So I'm going in there and I'm looking, or someone will call me about a lactation visit and they'll say, oh, well, my breast. And I'm like, it's always more than just breastfeeding. It's more than just breastfeeding a lot of the times. So that's when I really started diving into just postpartum care. And then it's also the mental piece, because if your mind ain't right, breastfeeding won't go right. Your body won't follow. So getting some postpartum mental health services. So if you can provide lactation support and help them with their mind and help them confidence and affirming and things like that, it is so golden. So think about when you add your credential, don't just add it for the sake of adding, okay? Because it's an expensive credential to get. It's a time consuming, it's a sacrifice from personal and from family. Think about it in the sense of how can I bridge a gap, make a bridge between care, have this continuity of care. How can I fill a void in the care that I'm providing, or maybe that the community is providing? And think about it in that respect.
I love that. And that for me really resonates with how I ended up where I am in my career. And on the way to get my IBCLC, I had to get some additional schooling because my original degrees were in business. And in getting that additional schooling, I said, you know what, I'm going to pursue something that's interesting to me. Unlike when I went through business, what was more interesting to me was public health. And so I got my master's in public health on the way toward IBCLC. And one, loved every second of it. Love digging into how breastfeeding is a public health concern. And that was the lens through which I did that work and pursued that degree. Now that allows me on the other side of it, on the finished side of it, to really present breastfeeding in this lens of public health in a really unique way as a lactation supporter. So as an IBCLC who is an expert then at breastfeeding, I'm now also an expert then at public health, and being able to meld the two and help organizations see how the work that they do really is impacting the health of the greater public, the public at large, I think is a unique skill set. And it's a pairing that maybe both aren't clinical in nature, but both are significant in a way that really creates a fantastic pairing, and has helped me to create this niche of work whereby I'm a valued and trusted voice on both sides. And it's even carved out work for me completely outside of lactation and having that expertise as well. I want to really shine light for a moment on someone who is an audience member who is a dietitian, Black dietitian, a CLE, and a licensed funeral director. That to me is an amazing combination. What? What? And they've talked about how they're able to use their lactation education across all of these fields, even in supporting families when the birthing person does not survive, or presumably as well, if the infant does not survive, they're able to support families through what it looks like to continue to feed the infant and meet their needs in ways that are, wow, wow, so unique, but I'm sure such a tremendous support to families in their time of grieving. So kudos to you. I want to know more about you. We have a question. Someone wants to know, is it okay to be employed at 2 different lactation support jobs? I don't see why not.
I don't see why. And in the words of Tabitha Brown, that's your business. That's your business.
That's your business.
Unless there is a clause in your contract saying that you cannot be employed with, you know, I don't know, competing business, you know, there's something there, some language, specific language in there. I would read that carefully in the contract. But if no such language exists, then you are free to roam about wherever you want to be. So, and that's just more lactation support, spreading, you know, the love and the support and encouragement and affirmations around. So, I don't see an issue with that at all. As lactation contractors, we are employed by more than one lactation thing. So yeah.
Yeah. So Nikki and I both, because we're in private practice, we contract with organizations to do work, and they're often, you know, I think I can speak for both of us saying we're contracted with several organizations at a time to do lactation support. There is, I think, an important distinction and exception. As Nikki's pointed out, there's sometimes contractual limitations based on what you've agreed to do when you took on the work. And one I know of is that there are some organizations or networks that employ IBCLCs right now. A few of them where you become a part of the network, and they provide direct clients towards you, and they take insurance, they take payment for you, and at least one of those has limitations on there's a non-compete clause, and you're being able to do work for other organizations. So you want to read the fine print. When possible, create your own contract, create your own agreement, so you can be fully comfortable with what you're committing to when you go in to agreements with organizations. But you want to be sure. So in theory, no, it's fine. You can be a lactation consultant for this group, that group, and the other. But unless you enter into a contract that limits your ability to compete, then you've, you know, cut off an opportunity to for income there. So be very, very careful.
Yeah, I know one of the things I wanted to get into before we got too far is talking about our scope of practice. When we have 2 different credentials, that can be really confusing and can cause stress. And I kind of touched on it a little bit earlier, is knowing when to stay in this lane and knowing when to stay in this lane, and which one trumps the other, right? And that can happen sometimes, as far as, you know, folks may be giving you instruction or something, and you're like, well, actually, I'm a nurse practitioner. And I don't like using that, well, actually, often, but it does come in, it come into play a lot. So you have to think about your different lanes and how they interact with each other, and you are bound by the highest level, the highest credentials board of licensing,
Say that
at
again.
all
Say
times.
that again.
You
That's
are bound by the highest credentials board of licensing. So for myself, I am credentialed by, I'm an international board certified lactation consultant, but I'm also a board certified family nurse practitioner by the American Academy of Nurse Practitioners. So anything I do, I'm held to that standard of care at all times. So, and they're like, it's great that you are a lactation consultant. However, up here, you are a nurse practitioner. So your highest credential. Now, if you don't know what that credential is, it a lot of times, sometimes it could be, in some of our cases, it could be our first credential. Let's say if you were a social worker first, or if you were a dietitian first, or any of those things. Now, here's the thing, and this is especially important. Think about your work as a social worker. You walk into a home, or you have someone in your practice, and you see something that doesn't quite sit well with you, and mandated reporting. That is one thing that under IBCLC, you're like, what is mandated reporting? As a nurse practitioner, I have to come in and report this. I'm a mandated reporter. Social workers, mandated reporters, things like that. So think about, you may think, well, this was a lactation visit. No, ma'am. You are also this credential. Therefore, you have to, if you see something, you have to say
Yeah, I think another way to look at that is the strictest credential.
something. Yeah,
Abide by your strictest credential, because that will help keep you in line with all of them. You know what I mean? So to Nikki's point, if we are not mandated reporters, but we carry another credential that does make us a mandated reporter, we should then abide by the most conservative or strictest um, guidelines that we're subject to. And I know that can be a little tricky because what if none of mine are? For example, IBCLC is my only clinical, or my highest rather, clinical credential. Period. My other credentials are, MPH is a degree, doesn't come with any sort of limitations in that way, and my other certifications would not be terminal a terminal degree or terminal certification as IBCLC is. And so I'm limited by what IBCLC says I can do and be, by our ethics clauses, by our documents that guide the limitations of an IBCLC. That is what I can go by, but Nikki has much stricter limitations to work
much.
within. While she can also diagnose and prescribe, so she has more flexibility, more, she has more, what is it called? I don't know. She can do more with the credentials that she has. She also is much more limited for liability reasons. She has much greater liability than I do. And so she even has to carry a little different liability coverage than I do.
My liability coverage is 6,000 a year, whereas other people's are not. So just think about the difference in that, and even liability insurance. Like, oh, it's an IBCLC, like, I don't do a whole lot, or you don't feel like you're doing a lot. But think about the words that you use and the recommendations that you make and the impact it can have. It's just feeding a baby, right? And people take this to heart and may even twist it. So you always want to be covered in all costs. There's a question. Nervous about retirement and benefit? That is a great question. I actually just signed up for retirement. I'm in private practice and just signed up for retirement because my partner and I had this conversation. He's kind of like, so what you doing for retirement? And I was like, I thought you and me, we were in this together. But you do have to have some retirement, and I met with uh, I mean, Northwestern Mutual, a retirement company, and they gave me some options of how we can start taking that out, and different ways of investments and different things like that, like 401k, Roth, and all these things. So I would meet with a specialist. And I wouldn't try and figure it out on your own at all. My employees just went to employees. They are W-2 now as of June. So it was a big month for us. We have workman's comp. You can hurt yourself picking up these big old babies or slipping in somebody's house, or things like that. So think about that kind of stuff, and make sure you're covered in all those areas, especially folks that work in icy conditions, right? Or I work here in the marsh of New Orleans, and we flooding and different things like that. So think about your area and your region and some of the risks that are associated with it, and please cover yourself. You may think, man, this is expensive. It's more expensive being out of work
Yeah.
and being in the hospital and all that jazz. So making sure that you cover yourself.
That's a great question. Yeah, there are certainly numerous benefits to being in business for yourself. But then there's also great responsibility to make sure you're taking care of yourself in the long run,
Yeah.
from taxes
Okay.
to retirement to liability. It's all on you. You don't get to, get it from your employer because you are it. And so it's important to pull in the resources and the experts that you need to make sure that you're doing things well. Nikki and I are both excited about our new bookkeeper. our new
Yes.
CPA, keeping us in
I love
line
that.
and making sure that we
Making us
are
legit.
being legit, right? Doing all the things we've been telling you all to do. We're excited about keeping our books in order in the new moving forward. So those are things that you absolutely need to think about and need to be aware of moving forward, and get some expert insight on what makes sense for you and the way your life and your business are set up, for sure.
Yes.
Um,
How do physicians, IBCLCs, handle malpractice liability? So in your malpractice, and I can speak to this because I have that type of insurance, there is it's a not a rider, but a consultation. So you provide consults, education, teaching. That needs to be checked, and that is part of your insurance. So it's something that's maybe there's a rider added on to your insurance. We said, are you doing consultation and teaching outside of the medical practice, all the medical clinical stuff that you're doing, consultations and teaching? That's the basis of the IBCLC and the lactation malpractice insurance.
so you don't have to carry the separate lactation liability that all of us carry. All of it's captured in
Right.
your
Hmm.
medical liability. Got it.
At least as told to me by my provider, my insurance provider.
Fantastic. Yeah, yeah. And there may be some nuances that you want to, so that you want to have a conversation with your insurance provider to make
Yes.
sure. And I know that the one that so many of us use for lactation support, if that's our main clinical work, they're, pretty straightforward. You just check a box on the website and you have your coverage, but it may be worthwhile to have a conversation with them as well, if you have the opportunity to. Angela, did you have some further thoughts on the question regarding retirement that you wanted to offer? We can't hear you.
I'm here. Sorry, I know I had to unmute myself. No, I agree with Nikki. It is good to get some good information from someone who is a CPA or something. As a consultant, you can actually, and if you're your own LLC and or some sort of an incorporated body, if you're working as a consultant, you can actually get something called a solo or a uni 401k in the United States, so that you can contribute as both an employee and an employer. And there are several options to doing such a thing, and really trying to find an investment firm that has low cost. In other words, that are used to dealing with these, with dealing virtually and or dealing with people who are self-employed, is something which is super important. So I agree with Nikki on that context. And there's a lot of benefits to it, but as you both said, you do have to plan for these things, and you do need to think ahead. There is, the job of an IBCLC doesn't inherently provide you with those sorts of protections that you would have if you were working as an employee. So again, for someone who is trying to make that determination to become an IBCLC, do a good, and as Nikki and Nikki have discussed in previous webinars, do a nice market analysis and find out before you start on this path and on this career what sort of options you have for employment. So if you enjoy working for yourself, then absolutely this is an opportunity. And or if you would like to work in a facility or with another organization anywhere in the world, then you need to find out what is in your community and what you would need to do. Thank you.
Thank you, Angela. Angela or Nikki, I think for those who are listening and this is all new information, they want to know, who is that person? Angela mentioned a financial advisor. Is that who someone would see to learn more about the solo or uni 401k?
Yeah, I have a financial planner that is on a personal, that helps with all of the financial planning in our home. And they were like, well, Nikki, what about you? We talked about your partner's plan for retirement. Do you have one? And I think one of the best pieces of advice that I was given in starting my practice, which will be 10 this year, is just like you plan, you have your ideas and all that kind of stuff on how to start it. In that same vein, you should also have an idea of how you're going to exit. And you should always think about your exit plan, because that will dictate the different steps that you take in the apex of your business. And when it's doing amazingly well, how are you going to taper yourself off and end it? And you may think, well, I don't ever want to end it. No, no, you do. And so with that, how are you going to retire? How you're, how are you going to live after this? Or maybe it's not something that you want to be like, Oprah status. You just want to have a small hometown business, and that's fine. Still, those businesses still need to have an exit strategy. That exit strategy includes your retirement and all those things. Will you sell off your business? Will you sell it to someone else? Things like that. So keep that in mind as you're planning your businesses and your practices.
That's a great point. So it felt like a tangent, but it's not really. We're talking about mixing credentials and competing credentials and wearing other hats in addition to your lactation specialist hats. This is a really interesting place where you can consider, do I want to get this other credential, because that may afford me a bit more stability. It may be the
Yeah.
thing that
Mhm.
keeps me, with benefits, keeps my retirement
Right.
rolling in. You know what I mean?
Hmm.
Maintaining this other credential may be the thing that helps your lactation work um, still be buttressed, so that you have some support
Right.
long term, even into after you're no longer working. And so it's a great question. It's a great question. On the other side, adding the lactation credential adds a lot of new expertise and insight, and being able to support families in a better way to what you already may have as a robust career,
Mhm.
helping families and benefited career.
Right.
So
Right.
this may be a great way to add on to that career, in addition to, or instead of switching completely.
Hmm. You don't always have to pivot. It can just be an addition, things like
Yeah.
that.
Yeah. A part of that is accountability, right? A part of
Mm.
all of this is knowing who you are accountable to. We've talked through, you're subject to the regulations of the highest credential. You're also accountable to them. You also, need to be fully aware for every credential you carry, who you are accountable to, who you answer to, who you go and ask questions to, who can clarify what your role is, where your limitations are, and where some overlap or conflict might exist. We cannot stress the importance of that enough. You have any other thoughts on that, Nikki?
Yeah, I kind of get myself in these holes sometimes, and I kind of forget sometimes, and I think I have to have doctors and pediatricians and whomever pull me back in there, like, but you're a nurse practitioner, can't you do? And sometimes I don't want to be in that role, but I also have to remember you are still in that role. You can't take that role off. It's hard to turn. You can't turn those roles off. They coexist together forever once they're merged together. So as I try and think about lactation, and I'm like, don't worry about that. But no, I can never turn that role off as much as my colleagues won't let me, especially in reporting and things like that. And then the flip side as well. So think about how these two roles work together, because sometimes they may actually compete, in your space, and put you in some positions that you may not want to be in. So I know some, for example, in outside of lactation, birth workers and RNs, sometimes that can be for some just a tense moments, because some days you're the L&D nurse and some days you're the birth worker supporting a family. They're actually different roles. And so you may feel like they're competing with one another, and you can't do them well.
Yeah, I think that that's a common conclusion to get to if you're both a volunteer supporter and you do this work as a clinician. It's difficult to
Mhm.
draw that line, and there's some separateness that needs to occur. We'll talk next time about documentation, and that's just one of the many ways that you need to keep your work separate, depending upon what hat that you're wearing, such that my interactions with families that I do at no cost should be completely separate, and those files should be saved separate from interactions I have with clients who I'm beholden to HIPAA and other regulatory guidelines and limitations. I am need to be very careful and very clear about the role in which I'm interacting with the family, and what I do with the information I get from the family is just as important as well. Hope that makes sense.
Mm-hmm.
Yeah. Yeah.
Yes,
Any
absolutely.
any questions or thoughts out there, Angela? We want to hear from folks and make sure that we are answering all that is before us. Let's see.
So I sent one to you, but there is an interesting comment here about someone who, in the meantime, someone is saying sometimes, oh goodness, this person wrote a second one, so this is super helpful. Sometimes dietitians are accused of not being supportive of breastfeeding because they recommend formula feeding. As a dietitian myself, I'm a little torn about this because I want the RD to consult with an IBCLC so that lactation support can be provided when appropriate. However, in the meantime, the RD is responsible for assuring nutritional support to the baby. Also, dietitians may have, quote, relationships with formula reps because they have to stay current on different infant feeding products. As an RD IBCLC, sometimes this is very tricky. So that's one comment. Another one is someone is asking, as an RN who works for the Department of Defense, so they work for the US military, and an IBCLC, do I need insurance or liability? And some other people are asking that if they're working in a hospital setting or in a facility, whether or not they need liability insurance. Do either one of you know the answer to the question? I mean, I have my assumption, but curious what you would say.
I would say check with your facility because sometimes those things are in your contract where you are covered when you are in that space. But once you provide care outside of that space, then you are not covered under them. So you may, if you're doing this privately, then you do absolutely need your own insurance. But a lot of times your contract, just as an RN working in a hospital, we don't have to necessarily have insurance. We are covered underneath the hospital. It was in my contract. As long as I'm providing care in that contract in that hospital, on any of those floors, I'm covered. So the same could be true, but I would talk to your HR department. That's a HR question because I'm assuming there are a lot of different variables in play with that.
You had thoughts, Angela?
No, I agree with that statement, but I also think that it is, it's something where in the United States, the liability insurance, the cost is nominal. And so that may be one of those things that we do to take care of ourselves, right? Like planning for our future, planning for retirement, planning workman's comp, things like that. And so indeed, I think it is something where if it is something that you are able to, that should be something that you can prioritize as far as what do you need to pay for in order to work at that facility. And I know in the United States, it's anywhere from, I want to say like $95 to $150 US dollars. And so do take a look in your region, what would work best in your setting.
Absolutely.
Yeah, thank you for that. We have another question that's pretty heavy here. So they are a doula and NRP certified RN. They want to know if they're attending a home birth as a doula and the midwife and birth assistant need assistance with an infant that requires resuscitation. How does that work with their credentials? And Nikki, your thought there?
The NRP certification is a certification. Just cover like CPR certification. So if you have that certification, you can offer that assistance in good faith because you received all of that training. This is actually, I'm a CPR instructor, anytime someone becomes certified under us, they're working within the certification of they've taken this training, they've shown their skill level, things like that. So if you need to render aid in the moment, you render aid. Just like I haven't certified within the hospital in a long time. I've been community, but if I go in the hospital and the code goes down, I'm running to it to assist. So whether I work there or not, or when I'm in that capacity or not. So that is more of a kind of like a certification of not necessarily to a career credential per se. It is a CPR certification. If you know it, go help. They may need your assistance in that way. And you're covered under the Good Samaritan law that you rendered aid based on the skills and the training that you've received. Therefore, you will be covered under that. Now, that is in the United States. I'm not familiar with the Good Samaritan law in any other country, but in the United States, you're covered under the Good Samaritan law if you have a CPR or rescue certification.
Yeah. I hope that helps. That makes sense. Yeah, I just have the minimum CPR certification required in the IBCLC, but I would be expected to, and I think welcomed into supporting someone who requires resuscitation as well.
If I can make a comment here, there's another comment here. This person, oh my goodness, they are a registered nurse, massage therapist, CBS, and doula in training. I'd love to focus my work on mothers and providing prenatal and postpartum care, but I feel like it's hard to do too many things within one business.
Mm-hmm. That's that is the key. Sometimes you can feel like I need to solve all the problems, or I need to do all the things for this family. Well, here's the thing. You have to figure out what your one thing that you love doing, that you do well, and focus on that one thing and be the best at that one or two things, right? If you can't, we can do and we can do all the things and be kind of good at them and provide good service, but you want to provide awesome, amazing experience, find the one or two things that you're really, really good at. That's your skill. Everybody knows you for that. Go in there, you do it, and the parent is like, the most amazing person that does that. You want to be the most amazing person that does that one thing, and not necessarily they'll call you and they're like, yeah, she does everything. That's a compliment, but it's not.
You know what? I hear this person's amazing skill set, and I hear it sounds to me like they are a doula, I think.
Mm-hmm.
Primarily, right? So you can do a
Mm-hmm.
little massaging of mom. You can do
Mm-hmm.
some support of infant feeding in that role. But it sounds like your expertise in general is taking care of the birthing person
Right.
and being a resource and assisting them with taking care of their infant. And so I would agree with Nikki that you pick what the overarching work is, and you can rub backs and support using your
Mm-hmm.
massage expertise. You know those pressure points, you know, which would be fantastic to help ease pain and support and during the time of birthing. But yeah, I agree with landing on a main focus and using and relying upon those additional skills and um, information that you know to be a better support to that one main role that you're having. But nothing wrong with wearing all the different hats. That's
Yeah.
exactly what we're talking about today. But yeah, when you're trying to market yourself and tell families what you do, you can't even fit all that on a business card. I am a massage therapist, infant feeding specialist. I'm also a doula. You know what I mean? So just be the
Package
the,
it well.
the do it
It's going
all
to be an
doula.
amazing package.
Do it all doula.
Mm-hmm. To do it, I'm sure there's somebody called to do it all.
There you go.
Before we
That's
end today, I did want to touch on, with this mixing of credentials, how can you use that credential to get you to the door of the IBCLC exam? Okay. So Pathway One, all of my Pathway One folks, these are our folks that already usually have all of the back school training, right? So these are our healthcare professionals, dentists, dietitian, midwives, occupational therapists, pharmacists, physical therapists, SLPs, things like that. And you have a lot of those courses. So you have your health and science courses. You have that basic life support course. You know, you have a lot of those things. Then you can go Pathway One, which means you need that 95 hours of lactation specific education. And that 5 years, like, oh, I thought it was 90. That 5 is your communications hour skills that you need. And then you probably already have that 14 hours, but you still need that 1,000 hours of directly supporting birthing parents. And it's probably at your work. And that's why it's important that you keep that spreadsheet. You keep a list of all of those things, those hours that you're doing. In the event you're part of the 2%, 3% that gets audited, you want to make sure that you have that information. For other folks, and then, also our recognized breastfeeding support counselors that you may work in a paid or volunteer space, you can also apply for that Pathway One registration. If you have all those hours, you're 14. Yes, you're 14. I don't know why I'm having blanks. Hours, your health and science hours, and the additional courses. still need that 95 lactation specific education hours. And you're getting your clinical hours through the support that you're doing with the approved organization. There is a list on the IBCLC website that tells you the approved organizations. You can't just say, well, I'm a part of this organization and it's in my
No.
town and we do support. No, I'm sorry, friend. That's not how it works. They want it to be approved and it has to come from that list. Now, if you would like to get an organization added, then that's when you need to contact IBCLC and have a very probably long discussion about getting your organization added. So, did you have
Yeah.
something to say?
No,
Okay.
yeah, no, that's great. So the majority of the folks who are on this call who are pursuing the IBCLC credential will fit within, I think, pathway one, as Nikki has said. It sounds like you're already doing some work. However, if you cannot get enough of those hours, either through your volunteering through a recognized breastfeeding support organization or through your work, and we're talking about hours specifically supporting dyads, birthing people and infants in the infant feeding experience. If you can't get enough of that, then pathway 3 is probably more appropriate for you, where you find a mentor who is an IBCLC. And again, you get that approved up front you set up an official arrangement with IBCLC for them to be your mentor to get clinical hours training directly with them. It's probably least likely, if you're talking about pursuing the credential and you're already doing some other work, that you'll be pursuing it through pathway 2, because that generally takes enrollment in a course full time at a university generally, and not a lot of us have the flexibility to do so if we're already working in some other field. So you're interested in what pathways, we have a fantastic video up on LER's website that will talk you through each of the pathways in much greater detail than we've shared today. Maybe we can have that linked right away, but if not, it's not too difficult to find on LER's website under pathways and how to get to the certification of IBCLC. Whew. Is that it? I think that's it. In closing, we'll see if we can get that dropped in with you, and if not, then maybe we'll share it from Nikki and Nikki's social media platforms afterward as well, if it's not dropped in the chat. The next time we'll see you, we think, and I'm saying that on purpose, is in 2 weeks on July the 21st. We think because there are some really important competing simultaneous events happening at that time. The Rose Annual Breastfeeding Equity Summit will be taking place during that time. And also something that's near and dear to our heart, USLCA will be hosting their DEI seminars during that time window as well. And that's a super important topic to us. So we would not like to take your attention away. So we plan to be here in 2 weeks because we don't want to miss you again. And if you're already committed to being in either of those other spaces, you can catch us on the replay, perhaps. And if we decide that we just don't want folks trying to decide which of these things to attend, we will of course let you know, and we will postpone our documentation talk accordingly. But we're really excited to get before you and talk about documentation, and we don't want to miss any more weeks. So we may be here, and you may have to catch us on the replay if you're already committed to attend Rose or the USLCA webinar. Hope that makes sense. Stay tuned. Stay tuned. Any other closing thoughts, Nikki?
No, I think I'm good. I just had sent over the chart that IBCLC has, that little algorithm chart of which pathway should I choose. I put that over for Angela and Steve to pop it in the chat for y'all just to look at, just to give you an idea, and they'll help you navigate you through the video, the LER video that we did about the various pathways. And we'll try and get that up for you. But we want to thank you so much for showing up and showing out. And there's so many of y'all today from all over the world. And we really, really appreciate that. We appreciate y'all. Just the support is amazing. So
For riding with us. We appreciate it. We look forward to being back on this ride. Thank y'all for sticking around with us. And we'll see you, we think, in 2 weeks. If not, we will let you know when to catch us again. We appreciate y'all. Y'all stay safe out there. Stay sanitized to the best of your ability.
stay safe.
Same.
All
We love you.
right.
Take care.
Bye, everyone.